New at 4:30, working from home has become a normal concept for many professionals, but a new study shows a dangerous result. It has changed many people's relationship with alcohol. A study from the National Library of Medicine found working at home may facilitate alcohol use that otherwise would not happen. So is it actually healthier for workers to go back to the office? Joining us now to talk more about this, Dr. Craig Allen, Medical Director at the Rushford Center Behavioral Health Network. Dr. Allen, thank you so much for being with us.
Thank you for having me, Erin.
So really, it's a surprising number of employees are drinking on the job. I was reading this one study, and it said 83% of employees reported consuming alcohol on the job at least twice a week. That is an unbelievable statistic. It just blew me away.
Yeah, I saw the same article. That's pretty striking. I think particularly for people that may have been in a position where it was okay to have a drink at lunch when they were working in the office, this not being in the office at all sort of takes the curbs off the road. And it's still quite striking and concerning, particularly when you look at the rates of deaths from alcohol in 2020 compared to 2019. The rates went up 25%. So this increased drinking, increased opportunities to drink, coupled with what were already increasing levels of people having alcohol use disorder and alcohol-related problems, should give us pause. And here in the month of alcohol awareness, April, we should take a look at relationship with alcohol and how we're using it.
What do you think is to blame here, Doctor? Why do you think we're seeing this change? Is it just people trying to cope with stress, dealing with the pandemic, or is it the accessibility that maybe their kitchen is just a few feet away?
Yeah, both of those things, and probably a few others. Stress is a huge driver of drinking, particularly for people that may already be drinkers or even heavy drinkers. And we know that in these times when there's a pandemic or, after Hurricane Katrina, drinking went up. So that's part of it. But also, there's not a bartender. The drinks are inexpensive, and the pours can be large. So that oversight, that reportability, responsibility that you have when you have to go back into the office isn't there. And although people might not think of themselves as I'm going to drink if I have an opportunity or not. It's there. It's where you're used to drinking. There's a lot of stress, and one drink can lead to another. So it's a combination of all of those things.
If someone at home is watching this right now and saying, oh no, I think I'm one of those 83% in that study, and they think they have a problem, what is their best course of action?
Well, cutting down is a good strategy, but not knowing how much someone is drinking, there's a risk of cutting down if you've been drinking a lot for a significant period of time of having withdrawal symptoms. That could be dangerous. So talking to your doctor about it. Cutting back completely can be concerning and cause medical complications if you've been drinking a lot. So talk to your doctor about it. Call a healthcare agency, get an evaluation, but don't ignore it and don't just continue to drink. This is a time when we should be taking a look at our relationship with alcohol, and that's why it's good to bring these kinds of things out into the open.
Absolutely. We can't thank you enough for bringing some awareness and your knowledge to this interview. Dr. Craig Allen, we appreciate you being with us.
Thank you very much.